Hello, guys, and welcome to Logic Box with me, Jones. Today on the phone, we have Cindy Ofori-Appiah, Senior Public Health Nursing Officer in Ghana. We're going to talk about coronavirus and how the country is dealing with this global phenomenon. So, Cindy, thank you for taking time out to talk to us today.
Thank you for having me.
So, Cindy, just give us a brief background as to how the country is dealing with this global phenomenon, coronavirus.
So currently, we have 3 deaths, and then we have 136 cases as of yesterday.
Yeah.
And the recovery, we had one recovery. So that's so far the number. We are praying we don't go beyond the 136 because every measure is being put in place. And yesterday, late night, the president spoke to the people of Ghana here.
Yeah.
He gave a statement for a lockdown for the epic centers. That's the Greater Accra region,
Yeah.
and Ashanti region, these two regions, because of the outbreak and how dense the population is. So currently, we've been given 48 hours as the citizens of Ghanaian to prepare. That if you're not ready prepared or if you're not fully prepared, so that the lockdown can take effect from Monday.
Okay, so in terms of, because I think the last time we spoke, you mentioned the amount of media adverts that has gone out to inform people on how to the protocols to follow, i.e., washing your hands and social distancing, and also right now a lot of people are being told, the whole country rather, being told to stay at home. We've seen a lot of videos circulating on social media where people are actually not practicing the social distancing.
Um, for the education is still ongoing. Through information vans and cars going around, media houses are helping to raise the awareness and campaign. It looks like most people are adhering to the precautionary measures. Others are not taking it serious. Others are joking with it, on social media, making fun of it. They feel like it's something that is not real. It's something that is not happening. Others too believe they have that kind of myth. Many people believe in the myth related to the COVID-19 that if you are black, you are quite safe. And then the weather being hot, weather these days, they feel like you are safe. But it's here. We are still encouraging people. We are still educating people in different languages in the country. Person really understand. And now many people understand. And the challenge we have now is the social distance. And currently, um, because of the information from the minister yesterday, trust me, what is happening in town now, everybody has automatically forgotten about the COVID-19 precautionary measures with regards to social distancing because everybody is trooping into the banks, at the ATMs, in the market areas, and they don't even care about the social distance because all that they want is they really want to get prepared. They really want to get food stuff or other things to stock up their homes. And they've ignored that particular part. And it's very scary, as a health professional. It's very scary. I had to go through town today to make sure that all these things, and today in fact personally I'm going to town, and even if you speak about it, you talk about it, most people don't see the reason why you are telling them that they should give you social distance at this time. Because if those who know Ghana very well in some of our markets, the way the structure is and the setup, it makes it difficult for we to have the social distancing. And it's in something that is really bothering me today because I got a bit scared. And another thing that is happening, most people are leaving Accra to other regions that is not being locked down, which is scary,
And that was going to
because we are
be
trying to.
and that was going to be a follow-up question with regards to the lockdown.
Okay.
Many have
Yeah.
said, why not the whole country? because people, as you've just mentioned, people will leave Accra and the areas that have been locked down and go to other parts of the country, which could potentially people there get infected.
Yes. In fact, the Ghana Medical Association and other stakeholders, health stakeholders, were championing and asking the government, to give us the total lockdown. But the situation in the country, is quite difficult. It's not realistic. I don't know what to say, but it's tough, very, 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 very tough. And the government or the president came out. That was 3-4 days ago to speak to Ghanaians that there are so many options on the table and so many consultations being done, whether to do the total lockdown or to do partial lockdown or just do with the epicentric areas. But now that we have this and the people are moving to other regions, it's becoming scary for us because it looks like we that are supposed to be in isolation here. Because now what we are saying is everybody is positive until lab test is done to confirm negative. Because we don't know who is the carrier.
And how is it going in terms of people getting tested?
With the getting tested, that is another thing I believe that the government and the Ministry of Health and Ghana Health Service, I believe they are really working on it because we are championing on it to get the test kits so that we can do the test to ascertain, to know that, because it takes 14 days for you to see the symptoms. So we are hoping the opportunity or that one to, because we know it's on the table for the government and they are working on it. And trust me, if it comes out, many people are going to be quite safe and sure of their health status because everybody is scared. We are trying to tell everybody to calm down. We are trying to put the fear and anxiety away, but rather follow the measures, the preventive measures so that we all stay on the safer side. That is the major thing we are doing now until we hear anything from the agencies, that's the health agencies, Ministry of Health, Ghana Health Service, and the government, that maybe the test kits will be ready and when they are going to do it and whether it's going to be free or it's going to be subsidiary with the amount and where it can be done. We are waiting for that. But now, if you remember the last time we talked about the centers, and I made mention of 2 centers. Now, because of the figures going up, we have Kolobu Teaching Hospital having a whole bay, then 37 Military Hospital having a whole bay, and then now we have the Ga West. There is a very beautiful hospital, a very new, hospital. And now it has been turned also to an isolation center because of the figures coming up and how prepared we are to, break the chain, the chain of the cycle. So I will say now the centers is no more 2. But now I think we have about 5 now. And then Kumasi, we have one in Kumasi too, that they are also doing the whole day and isolation centers there. So I think gradually, I believe other regions, the capital cities and other regions definitely are also going to get isolation centers, which is what we don't want. We don't want it that way as a healthcare professional. And I know I speak for some of my colleagues. We don't want it that way. We really wanted to. If we are just tackling those 2 regions, we pray it just, break the chain. And then the 136 we can deal with that.
Speaking to your work colleagues, the ones at the forefront, do they have the right equipment in dealing with people who come in who are infected to stop them from getting infected?
Currently, I would say yes. We have the right PPEs. We got short of face mask, but we got benevolent people in the society who supported, and now we have the philanthropist people also supporting to help us get the right things to work with. we've got the PPEs for the frontliners to work with, and then we've got it even for other clinics and other hospitals, wherever that is. Because now, as I said, everybody is a potential positive client or patient until lab test is done to confirm the negativity of that result. So now I will say we have them. It was a challenge. We have them, but it's not as to our expectation, 100% expectation, because I remember last week, even the United States of America, they were even complaining of facial mask, that they needed mask, We as a developing country cannot boldly compare ourselves to the developed countries, like the US and Italy and UK. Yeah. We can't. In terms of sophisticated machines or equipment, ultramolding machines and stuff, dealing with these issues. But we are prepared in our own capacity as Africans, as Ghanaians, to battle with this virus, whichever way. So whatever that we are having, it's in the right way to manage the cases.
I think before I let you go, our Prime Minister here, Boris Johnson, in one of his updates said, told all of us really, and said that unfortunately we will lose some of our loved ones. And I think at that point, it really hit home for a lot of people. The government and the health professionals can do what they can to try and contain this virus. However, the citizens have to play their role as well. And this is where it seems very challenging. What steps can be taken to really drive home the importance of social distancing?
Yes, we really want to encourage everyone. In fact, we are still doing it. We are still doing the education and the importance of the social distancing. Even Jones, with this lockdown, trust me, it was a battle, It was a battle. Many people were arguing that, why do we have to get a lockdown? We are not like the developed countries to lock down. We can't do that. We are not ready. It doesn't, fit our economy. It doesn't fit our status. It doesn't fit our lifestyle and culture in the society because of the nature of people and the kind of businesses that we do in this country. Many people were against it. Others too were for it. I believe the president listened to various consultations and ideas before coming up, because even in his statement, he said something like, we know how to bring back the economy to life. What we don't know what to do is to bring back the death.
Right.
And then to me, I think that was a very sensitive thing that he said, because at this point, we need to, save lives. Yeah. But with the economy, every other economy in every affected country is being affected as well. Because when you get COVID-19 in your country, you have two things to deal with. The first one is your economy, and then the second one is your health system and the people in the community. Yes. So now our focus is mainly on the people. And the social distance, trust me, we are still on it. And I believe by Monday, the chain has to start breaking, because the place or the marketplaces are not going to be busy, and the streets are not going to be busy. The shops are not going to be busy as we are seeing now. Now it's scary. It looks like most people didn't understand the government or the president's statement. Most thought that Monday, the shutdown or the lockdown means nothing is going to work. But in the statement, he said even the banking halls will be operating, but with restriction and measures. Yeah. But people didn't see it that way, and now they've done their own interpretations of the statement, and they are doing everything that they can in the markets, all the markets in Greater Accra region. And I believe whatever is happening in Accra is happening in Kumasi. And to me, it's scary. The panic buying is not something that I'm so worried about, but the social distancing is what I'm scared about. Okay. Yes, because everybody is doing anything anyhow. And I tell people that getting the COVID-19, you won't show symptoms immediately. You'll see everybody as a normal person until the incubation period reach its peaks. Then you get to show symptoms. But people are trying to get it. Others too are still battling with understanding. So we hope by Monday, this kind of, issues you're having in the market will stop.
All right. Cindy, thank you very much for taking time out to talk to us. I'm sure we'll speak again.
Yes, you're welcome. You're welcome. Thanks for having me.
Thank you. So that was Cindy Ofori-Appiah, Senior Public Health Nursing Officer in Ghana that we've just spoken to, giving us a background of what's happening in Ghana to do with the coronavirus, how the country is preparing to tackle this global phenomenon. Now we're back to the UK on the phone, on Skype actually. We have general practitioner Adwoa Danso is here with us. Okay, let's talk about the measures being taken by the government. Your assessment on that.
So I think it's really difficult because they're in a really difficult situation, and I definitely understand that, you have to, your actions are going to, save people's lives or not, and you're trying to balance up so many different organisations, so many different reasons, and to keep people safe. I do think that there was a massive call for social distancing and to have what was called lockdown. I think that was really necessary because people didn't really understand why and didn't really understand that this is affecting people on our doorstep. It's not away from you, it's around the areas that we all live. So I do think that was something that needed to happen. I'm glad that it's still in place. And I do think people are really understanding why it's happening. When we look, when we all turn on the news in the evening, we see the number of cases, we see how quickly those numbers are going up. And our actions now will determine those numbers in 2 or 3 weeks. So it's so important that we continue to social distance and self-isolate as well. And I think it's really important that people understand the differences between social distancing and self-isolating as well.
Okay. On social media, there's a lot of myths on social media, and I just want you to clarify a few things for us. So,
yeah.
One thing that was actually spreading was that if you're somebody, if you're a black person, you're immune to the coronavirus. Clearly, that's not the case.
Well, unfortunately, there have been so many deaths rapidly happening in Africa here that are affecting black people, Asian people that we have seen. I think those myths, I definitely received a lot of those chain WhatsApp messages that have come through. They are myths. They are not true. And I think it's quite dangerous that, people really do believe those things because unfortunately they may be spreading it unknowingly as well. So I think unfortunately seeing all the figures and seeing the numbers of people, those myths have pretty much demystified themselves. And they are myths and not true. I really strongly recommend that people go to very reputable sources, reliable sources for their information, not chain messages that are sent around. There was huge hysteria. There's a number of messages, particularly before lockdown was enforced, about someone working for here, giving people information about this. It's panic, and it leads people to panic as well. So reliable sources, WHO, Public Health England, NHS England, www.gov.uk has lots of information, and also the news. So I would stick with those sources to get your information as well. If you're in Ghana as well, the Ghana Health Services have a really good website which has all the information that you'll need as well.
Okay, so we'll still stay with the myths, so you can explain a few things to us. So a lot of things that people are also saying is this is some supplements that you can take that will help you. We've heard of vitamins C and D. And also, apparently, if you eat a lot of garlic, this will also help you either to fight the coronavirus if you get infected, or builds your immune system to a point where you probably might not get infected.
I think some of these things come from, well-informed data and evidence that it soon kind of changes as it's passed along. Vitamin C is important for our immune systems and a healthy development of our immune systems. Vitamin C in most people have a normal level if you're eating a good diet. It's quite rare to be deficient or to have a low vitamin C. we always strongly recommend that before you start any supplements, whether that be vitamin C, vitamin D, or iron, that you go and consult with your GP as to whether or not you need to have it, because it is rare, but sometimes you can do some damage if you take some of these vitamins and you actually don't need them. So there is some truth that vitamin C does help your immunity, but most people have very normal levels of vitamin C and won't require any extra vitamin C.
Okay. Now, again, there's a lot on, sorry to bore you, but...
you're not. This is not boring at all. No, and
up?
I get these. I get these questions all the time because all news travels fast. Whether it be good, bad, untrue, it travels fast. So people have these questions to me all the time. So not boring at all.
So, in terms of building your immune system, even this morning before we came live, I saw somebody posting the cooking up ginger, lemon, hot water to drink it is really, really good for you. Make sure you drink it. Let me ask you, if I was to do that continuously, does that make me immune from the coronavirus?
Absolutely not. There's definitely no truth in that at all. The virus does not discriminate whether you're drinking lots of hot water, lemon and ginger. But we do know that there are some people that are slightly more immune, whether they have health problems. So people with diabetes, for example, people with breathing problems like asthma or COPD, people with immune problems like HIV, certain conditions that require drugs that reduce your immune system. Yes, they are more susceptible. So drinking hot water, lemon and ginger might make you feel better, but it doesn't necessarily protect you against catching the virus.
Okay. And then finally, before I let you go, we've seen the way in which the coronavirus has really impacted countries such as China, the United States, and especially Italy. What can we learn from what is going on in Italy?
I mean, Italy, seeing the pictures and images from Italy and seeing what's happening to my medical colleagues around the world is just simply heartbreaking. What lessons can be learned from Italy? I mean, sometimes it's too early to see what lessons can be learned, but I do know that the social isolating and lockdown may have been a key. There was evidence to suggest that during the lockdown, people were traveling to other parts and other areas as well, which may have increased the spread. Also, that the population is slightly different. They have a slightly higher number of elderly who may have more complex medical issues, and also I just think people weren't taking it seriously. I've watched quite a few clips of mayors and governors who one of them I actually remember. He was saying that it's interesting how he has been running 20 years. And he used to go on runs and never see anybody. And all of a sudden, he's seen all these people who have suddenly become runners. So people just weren't taking it seriously. And that's why I think stay home is such a clear message, and why here in the UK we've been enforcing it. Because as you've seen in the news, we were or may still be following the same trajectory as Italy.
And this is a personal question. How have you been coping with
It's honestly been incredibly busy, and I know a lot of my GP colleagues will say the same. My hospital colleagues are working so hard. It's tiring, but this is what we signed up for. This is what we do, but we have to keep going.
And the other day, I think it was the whole country, if I should say. I think in the evening it came out to applaud, to appreciate the work you guys are doing.
Yeah, it was, to be honest, I was not expecting, number one, that anybody would actually come onto their balconies and be clapping. Number two, that I would feel quite emotional about it. So I was someone who was thinking, okay, this, what is this? Like, is this some sort of media? But it was very powerful, and it definitely lifted myself, and it lifted a lot of my other colleagues. So it's appreciated, and thank you.
Adwoa, thank you very much for taking time out to talk to us.
Okay, no worries. Thank you.
Thank you.